To all the respected pediatricians and august audience who graced the occasion. This is a 20-day neonate, a male neonate presenting with hypopigmented spots over both the cheeks, axilla and scrotum. The possibilities that you should consider for a neonate presenting with hypopigmentation are congenital.
I think we'll give the audience. I think you need to interact. It's for fun. Physician, heal thyself. CAH, that's it. What else
like
you
congenital nevi, bronze pigmentation, neonatal chikungunya, and congenital erythropoietic porphyria. And this case turned out to be a case of congenital adrenal hypoplasia. Yeah. What is the best diagnostic test?
Any takers? Best diagnostic test? Ajay?
Yeah.
Is that right?
It is indeed.
You should give him a
increased
Cadbury's.
17
Where are the
hydroxyprogesterone levels. What is the defect?
21. What is the defect?
21. Yeah. It is defective hydroxylation of precursor of steroids. Next slide. This is a neonate presenting with...
A quick interjection, Sudhir. The best diagnostic test would be a neonatal screen actually. A neonatal screen would pick up very early for two reasons. Number one, you would prevent a potential mortality if it's a salt-losing variety. And number two, you would be aligning the sex in the proper direction if it's a female child. Get along.
Yeah. This is a neonate presenting with purplish discoloration of the upper eyelid and the face and associated with contralateral clonic seizures. This is a classical case of Sturge-Weber syndrome. The investigations to be done for a case of Sturge-Weber syndrome are, not to forget is frequent eye examinations to monitor for glaucoma, and CT scan will show cerebral calcifications in tram track pattern, and early treatment of seizures to prevent mental retardation. It is a newborn female presenting with non-pitting edema of both lower limbs and more prominent on the dorsum of the foot.
Don't tell the diagnosis.
Yeah. There is no dysmorphism, no organomegaly, and no murmur present. Similar swelling of the feet in her father, which is asymptomatic.
What's the diagnosis?
No, this turned out to be a case of congenital lymphedema Milroy style. Please keep in mind, karyotyping has to be done with female neonate presenting with lymphedema to rule out Turner syndrome. If it's a case of Turner syndrome, always look for coarctation of aorta and horseshoe kidney. Next slide. This is a 5-year-old female child, short stature, presenting with hematological abnormalities like anemia, pancytopenia, and no organomegaly present, and raised DSR. Yeah, there is facial dysmorphism and also associated limb abnormalities.
Oh, ye to bol dega Ajay. But please tell me, what else are the external markers to diagnose Fanconi's? There you will get the prize. Gonadal abnormalities. Come.
Fanconi's anemia is a treatable condition, and bone marrow transplant being the treatment of choice. If you're planning for a bone marrow transplant, then directed transfusion should be avoided to reduce the risk of graft rejections. Next.
Later we'll give them.
This is an infant presenting with fever for 5 days duration, swelling of the face, irritability and decreased feeding. The swelling is soft swelling and it's tender and non-cystic and without induration. Oral cavity appears to be normal. What is the diagnosis? This case
What's the diagnosis?
Also can present as pyrexia of unknown origin.
Don't go forwards. What's the diagnosis? Oh, fantastic. Fantastic. But what's the triad with cafes? One is fever, the second is irritability, the third is a soft tissue swelling.
Yeah.
But who said cafes? Yeah.
Cafes disease is infantile cortical hyperostosis, most prominently involving the bones like mandible and maxilla. The investigation of choice for Cafes disease.
Yeah, any takers, investigation of choice. What would pick up Cafes? Diagnosis? No. Let's say radiological investigation. Let's say an advanced radiological investigation.
Hyperostosis, what is the name?
No, it is bone scan.
Bone scan. Who tells what the appearance will be in the bone scan? Any takers?
Diagnosis of the mandible and maxillary regions, and the bone scan shows bearded appearance and hot spots in the maxilla and mandibular region. This Caffey's disease responds well to steroids. The differential diagnosis that you should keep in mind for Caffey's are like hypervitaminosis A, scurvy, bone tumors, and prostaglandin infusions. Presenting with protruding tongue and prolonged jaundice.
But what are the early manifestations of hypothyroid?
What is this?
Yeah. This is an other neonate presenting with persistent diffuse mottling of skin on lower limbs and the trunk.
The case is done. But for what you want to give?
This is a case of neonatal hypothyroidism. What are the early markers of neonatal hypothyroidism?
That's great. Anybody? At least 3? You can tell 3? Good? Yes? Okay. It should be quick. Yeah. I think fairly good.
Neonatal hypothyroidism can also present as persistent mottling. In this case, it was picked up. The other early markers are like constipation, wide anterior fontanelle, prolonged jaundice, and protruding tongue. What is the screening test for this condition? Increased TSH levels in heel prick test.
Yeah, T4 and TSH, they could be either 2, or you can do with TSH and all elevated, you can work up for T4 also.
This is an infant presenting with multiple hypopigmented macules on the trunk at birth, and also associated seizures are present.
Fantastic. But tell me 3 skin manifestations of tuberous sclerosis. I think you should.
Sclerosis are adenoma sebaceum, shagreen patches, caféolé spots, and subungual fibromas. The investigations that have to be done for tuberous sclerosis. The CT scan showing cortical tubers and subependymal nodules. Here you can see subependymal nodules projecting into the ventricular cavity, showing candle dripping pattern. Renal ultrasonography should also be done to rule out renal hematomas, and echocardiography should be done to rule out cardiac rhabdomyomas. This is a neonate presenting with crooked smile and deviation of the angle of mouth.
It's a crooked smile.
Yeah.
Yes, it's a case of congenital absence.
That's great, but you won't get there for that. What are the 2 abnormalities associated with? What is it a marker for? Great. Of the congenital heart, what? Cyanotic, acyanotic? Acyanotic. With shunt, without shunt? हो गया, थक गया अजय.
The underlying.
One more. Anybody else wants to take? One is rightly said congenital heart disease, VSD. But anything else? No? Put the X-ray.
Yeah.
Put the X-ray.
The underlying defects are.
Look at that. Any takers for this X-ray? That's great. That's great.
Vertebral defects and cardiomegaly is present, and congenital dislocation of hip can also be present. This is a neonate with sudden jerky movements, sudden symmetric jerky movements of the limbs. The CT scan showing a normal study, and the patient is not responding to phenobarbital and phenytoin. What is the probable diagnosis?
That's great.
This is a case of pyridoxine-dependent myoclonic seizures.
Leave it there. Why are you waiting? You want one?
Patient responded very well to pyridoxine treatment. Next. This is a neonate with annular erythematous scaly rash on the face and scalp persisting more than 1 month, and mild hepatosplenomegaly. What's the diagnosis?
No, it's not SLE.
Mother had fever and rash previously, for which she received treatment. Yeah, this is a case of neonatal lupus. What are the diagnostic markers of neonatal lupus?
Yeah, diagnostic markers. I really don't know the answer. What are the diagnostic markers?
The diagnostic markers for a case of neonatal lupus are antero-antilla antibodies should be done both in the mother and the child. What are the associated anomalies with neonatal lupus?
Somebody said it already.
Somebody said it.
Blocks.
Yeah, it's congenital heart blocks. Thank you very much.